What would you do if you love your sport but suffer asthma when you try it? How would you feel if you could not join your friends in playing sports because you will have an asthma attack if you do? And what would you do if you frequently suffer difficulty of breathing whenever you climb stairs or run a short distance? Today, we are starting the preparations for the Tokyo Olympics, an Olympic that has been delayed because of the coronavirus pandemic. Athletes from all over the world will showcase their talents in their sports. There is a group of people who cannot participate because they get asthma whenever they exercise. Today, we will talk about exercise-induced asthma and the top 5 things you can do to prevent it. Stay tuned for this very interesting discussion. Everyone needs to exercise, even people with asthma. A strong, healthy body is one of your best defenses against disease. But some people with asthma have episodes whenever they exercise. How can this group of people be able to benefit from exercise without ever having an asthma attack? The upcoming Tokyo Olympics, which starts this week, is a celebration of camaraderie and sports and lots of exercise. The Olympics was started by the ancient Greek civilization. But aside from the Olympics, did you know that it was also the ancient Greeks who first documented asthma and gave it its name? Yes, Hippocrates, the guy credited with the Hippocratic Oath doctors still use today, was the first person on record to link asthma symptoms to environmental triggers and specific trades and professions, such as metalworking. However, Hippocrates only saw asthma as a symptom and not as its own disease entity. It was not until 100 AD that a Greek physician called Arrhetius of Cappadocia composed a detailed definition of asthma that was similar to the modern understanding of how the disease develops today. To cure asthma, Arrhetius suggested drinking a concoction of owl's blood and wine. Can you believe it? I'm glad that this concoction is no longer recommended. Anyway, asthma is usually triggered by many environmental factors. However, there is a variety of triggers that do not involve any substances entering your body. These are known as non-allergic asthma triggers. One of the most infamous of these non-allergic asthma triggers is exercise. Did you know that up to 90% of people diagnosed with asthma suffer from exercise-induced asthma? Yes, up to 90% of people living with asthma. Given that there are so many people with asthma in the general population, people who are susceptible to exercise-induced asthma comprise a total of up to 10% of the general public. This number is so absurd. This means that in a table of 10, you will have a good chance that one person has exercise-induced asthma. If you have a class and your class is of 40 people in your classroom, 4 of your classmates, at least 4 of your classmates, may be suffering from exercise-induced asthma. If you have 10 people working with you in your office, at least one of them has exercise-induced asthma. However, that's not all. There are a good number of people who develops difficulty of breathing when they exercise. but they are not known to be asthmatic. For those who suffer difficulty of breathing when they exercise but have not been diagnosed with asthma, their condition is called exercise-induced bronchospasm. Basically, this is just like exercise-induced asthma, but you remove the term asthma and replace it with bronchospasm. People who have exercise-induced asthma usually suffer asthma within 5 to 20 minutes after the start of their exercise, or 5 to 10 minutes after they stop exercising. So, what should you do if you experience these symptoms? Well, first of all, you should inform your doctor. Your doctor will be able to guide you and help you make an asthma action plan. An asthma action plan will tell you what you need to do before, during, and after your exercise, or before, during, or after an asthma attack. This asthma action plan can be changed or modified over time so that it will adjust to your needs. If you have exercise-induced asthma, you will experience coughing with asthma, tightening of your chest, wheezing, unusual fatigue while exercising, shortness of breath when exercising. So, if you have asthma, should you avoid exercise altogether? Well, when I was a child, I was also advised by my doctor not to exercise because I would get asthma. However, this advice may lead someone with asthma into obesity, a sedentary lifestyle, or even affect his or her self-esteem. So doctors today advise young people with asthma to exercise but to take necessary precautions. So, you shouldn't avoid physical activity because of exercise-induced asthma. There are things you can do to prevent asthma symptoms and allow you to maintain physical activity. In fact, many athletes, even Olympic athletes, compete with asthma. They say that prevention is better than cure. So, here are the top 5 best ways to prevent exercise-induced asthma. Number 5. Take your inhaler before you exercise, and always have your asthma medicine with you when you engage in sports. Yes, this is the most common advice to be given to all. The most common medicine given to prevent exercise-induced asthma is the short-acting beta-2 agonist such as salbutamol, also known as albuterol in the United States. In general, we ask people to take in 1 or 2 puffs of salbutamol or albuterol right before they engage in their exercise or their sport. This medicine will open up your airways and keep it open for around 4 to 6 hours. So, this is plenty of time to finish your game. However, do make sure that you have your medicine handy in case you need some more in-game. Be sure that your inhaler has enough puffs left to last you a game and have a little bit of extra just in case of emergency. Some inhalers come with a counter to help you do this. In some sporting events, however, some bronchodilators are not allowed because they may give a competitive edge to their users. So, if you will be competing in sports, be sure to check with your doctor and the rules of your sports if your medicine is allowed in your sport or not. Number 4. As Hippocrates has pointed out, asthma gets triggered when a person living with asthma gets exposed to an asthma trigger. Most of these triggers are allergy-producing substances in the environment, such as pollen, dust, and smoke. Allergies happen when these substances enter your body and your body recognizes these substances as something dangerous. Therefore, your body produces chemicals and some of these are responsible for your asthma. So, if you want to prevent asthma, our tip number 4 is to keep your game area clean of dust, pollen, and strong chemicals that can trigger asthma. Some of these chemicals can be easily avoided, such as strong colognes, for instance, or air fresheners. However, this isn't always possible in some sports. For instance, if you play rugby, the rugby field could have dust that can trigger your asthma. Or in swimming, you could have the chlorine in the water that could also trigger asthma. The type of air that you breathe is also important. Cold, dry air is known to trigger asthma more than warm, humid air. In order to address this problem, some athletes who compete in cold, dry environments often wear a scarf or cloth over their mouth and nose to help warm and humidify the air they breathe. Tip number 3. When you do sports, you lose potassium very fast through sweating and other mechanisms. You need potassium for your body's muscles to work properly during exercise, and potassium is also known to help you from getting cramps. But did you know that the popular asthma medicine salbutamol interferes with your body's potassium levels? Salbutamol reduces serum potassium levels in your blood. So, if you are exercising and taking salbutamol too, you need more potassium. To balance this, you need to rehydrate properly. Many sports drinks are enriched with potassium, and this is one reason why they are very popular among athletes. Drinking electrolyte-rich drinks will help restore and balance this potassium level that your body sorely needs. If you would like to go for a more natural drink, you could choose to go for coconut water. Coconut water is fairly rich in potassium and is completely natural. Avoid heavy liquids such as milk, as these are not absorbed as easily. And besides, did you know that as much as 45% of children are known to have a milk allergy, and this can worsen asthma symptoms as well? If you have asthma, there is a considerable chance that you might actually have an undiagnosed milk allergy. So if you want to prevent exercise-induced asthma, hydrate properly with electrolyte-rich drinks. Tip number 2. Most athletes would warm up before their game. Warming up before a game for at least 10 to 15 minutes is thought to be a good way to reduce your symptoms of asthma. Warming up prepares your muscles and your body for more strenuous activity up ahead, and it may also help you become more confident in your game. Warming up will also provide you an opportunity to remind you to take your asthma medicine. An aspect that is often missed by athletes and weekend warriors is the cooling down aspect. Cooling down is very similar to warming up, but it is done after the game instead of before it. A cooling down session of about 10 to 15 minutes is also believed to help prevent exercise-induced asthma. So, tip number 2 is to do warming up and cooling down for at least 10 to 15 minutes before and after your game. However, if you will be joining a sport that will last a long time, such as a marathon for instance, or a triathlon, you may need to do longer warm-up and cooling down. And finally, we have the number 1 tip to prevent asthma. Many people believe that swimming can prevent you from getting asthma. But what is different in swimming compared to other sports? Could it be that the water ensures the air is not dry? Or perhaps it could be that the movement in swimming is different from all other sports. Even if in swimming you get exposed to the chlorine of the swimming pool, which can also cause asthma triggers, it seems that swimming can prevent asthma. Well, a doctor in Russia had studied this phenomenon way back in the 1950s, and what he found out will excite you. What if you could get the benefits of swimming without having to change your clothes and jump into a swimming pool? What if you could learn the benefits of swimming without having to learn how to swim? What if you could get the benefits of swimming just about anywhere and anytime during the day? Well, what this doctor found out was that the main difference in swimming compared to other sports is the way that the swimmer would be breathing. Yes, swimmers need to regulate their breathing in a special way to avoid them from drowning. When you run or do other sports, you tend to breathe harder and faster, and usually through the mouth. This produces a large increase in the amount of air entering your airways, and this air all require heating and humidifying. The combination of the increased air intake and mouth breathing causes this air to be poorly heated and humidified. Did you know that the volume of air that you breathe during exercise increases by 3 to 5-fold, whereas the speed or frequency by which you breathe increases by 1 to 3 times? In fit athletes, ventilation may increase 6 to 7-fold. This high volume of breathing air results in inflammatory, neuronal, and vascular changes, ultimately resulting in the contraction of the bronchial smooth muscles and symptoms of dyspnea, cough, chest tightness, mucus production, and even wheezing. This is why if you are unable to properly balance the amount of air that you breathe with the amount that your body needs, you will end up with asthma. Swimmers, on the other hand, need to time their breathing carefully in the swimming pool because they cannot breathe when they are submerged in water. Other sports do not have this requirement. So, by carefully timing their breathing, this trains their brain not to take too much air and prevents them from hyperventilating. The good news is that the Russian doctor I told you about was able to make a system where you can get the benefits of breathing like a swimmer without having to swim in a pool. A recent fitness instructor I just taught this to just last month was suffering from asthma, and he would control his asthma by swimming. This 23-year-old fitness trainer would frequently go to the swimming pool just to swim and prevent an asthma attack. However, because of the coronavirus pandemic, he was not allowed to go to the swimming pool for an extended period of time. Because of this, he had asthma attacks and needed to rely on his medications. I taught this fitness instructor the Buteyko method, and he can now apply the Buteyko method with his exercises. And now he noticed that with the Buteyko method, his exercises became easier and his asthma was prevented. This is consistent with the impressive results of clinical trials around the world that have studied the Buteyko method. These clinical trials are the reason why around the world treatment guidelines on asthma mention the breathing exercises as an effective way to prevent asthma and reduce medicine use. I have personally benefited from this system, and so has hundreds of my patients worldwide. Believe it or not, even Olympic athletes have used this technique to control their asthma and improve their performance. I will have a video on this in the future. And the best part of this is that the Buteyko method is a technique that is completely legal in all sporting events. If you are interested to learn more about this technique, I would love to invite you to download my free book and attend my talk on asthma. Check out the link I provided below, which will link you to my upcoming schedules and to my free book. So there are 1 out of every 10 people who have exercise-induced asthma. For sure, you know somebody who has it. Please share this video with them so that they can benefit. I'd love to hear your comments regarding this topic below. What do you think of exercise-induced asthma? If you enjoyed this video, please click on the like and subscribe button and ring that bell. This is a big encouragement for me to continue making more videos of this type. I am Dr. Charles Edward Florendo, medical advisor to the world's leading authority of the Buteyko method. I'll see you soon.